Causes of cancer. Mesothelioma. About cancer. Cancer mesothelioma is definitely in a problematic state, with the average person living for 12 to 24 months upon diagnosis. If you can detect it sooner, your chances for treatment success are far greater. The prescribed treatment of cancer mesothelioma has varying results depending on the location of the cancer cells, the stage of the disease, and the patient's overall physical state. The typical treatments for cancer mesothelioma are radiation therapy, surgery, and chemotherapy. There are many different types of cancer mesothelioma, and they are all life-threatening, with approximately 2,000 Americans diagnosed every year. Asbestos is the cause. This is a frightening fact because most of the authorities that okayed its use were aware of the possible illness. They knew that the handlers were bringing the dangerous substance home with them as well. That being the case, not only were the handlers exposed, but many of their family members were. Many of these family members with second-hand exposure developed the asbestos cancer, mesothelioma. When you are told the bad news of having asbestos-related mesothelioma, the good news is a mesothelioma lawyer can help you fight those responsible for this cancer. As a worker, if you have mesothelioma, the employer or company that put you into contact with asbestos is clearly accountable, and your family deserves worthy compensation. Almost all cases of malignant mesotheliomas happen in people who have been exposed to asbestos, on the job or by people they live with. The affected person is able to claim the compensation amount from the firms that knowingly exposed you to asbestos spores. An individual who has got mesothelioma through the contact of asbestos should seek immediate legal assistance to claim the compensation. By simply avoiding contact to asbestos, it can largely prevent malignant mesotheliomas. What are the symptoms? At the beginning stages of mesothelioma, the symptoms are non-critical, therefore the disease is not that prevalent and has a fairly good success rate. However, with pleural mesothelioma, it affects the outer lining of your lungs with symptoms like coughing, chest pains, breathing and swallowing difficulties, wheezing, shortness of breath or loss of weight. These are the same symptoms that apply to many less serious illnesses, but you are strongly advised to consult a physician immediately if you even suspect you have been exposed to asbestos. The incubation period of the can be over years, often many years. A lot of suspicion is needed to make a timely diagnosis of malignant mesothelioma, as the symptoms can be very subtle. This is because many of the symptoms are experienced in other sickness conditions. This usually means that delay in the diagnosis is very common in most of the cases, making its recovery rate difficult. Many times the symptoms can appear as non-specific to the patient and their medical professional. One of the biggest problems with pericardial mesothelioma is that its symptoms begin appearing in the cancer's latest stages. Remember that the onset of mesothelioma asbestos lung cancer is almost always very slow. If you are experiencing any symptoms, it is not worth chalking it up for a common cold and moving on. Consult your family physician now. Mostly in the chest, most of the mesothelioma symptoms are caused by excess fluid between the lining of the lung and the chest cavity. You may experience extreme pain in the ribs or chest, which is also agitated by the spread of the cancerous tumor. To provide relief from the symptoms and help regulate discomfort, doctors may use a needle or a thin tube which serves as a drain to the chest or abdomen area. This procedure is known as thoracentesis, and removal of fluid from the abdomen is called paracentesis. What are the treatments? Mesothelioma cancer is currently treated with 3 types of treatment and the patient's general health and age. These treatments depend on the cancer location and the disease stage. They include surgery, chemotherapy and radiation therapy, not necessarily in that order. They are sometimes used together to fight the disease. Because this disease's symptoms are slow and steady, the success of many traditional treatments are very limited. Usually before a patient is treated, the doctor will evaluate them first, and then make a prescribed plan for treatment. Unfortunately, aggressive treatment strategies are almost always used, but it really boils down to how far the cancer has spread. Mesothelioma cancer has no known cure, but chemotherapy, radiation therapy and other pain treatments can help the patient deal with the discomforts and increase the life expectancy. Surgery is very common. When surgery is scheduled, many tests are done to make sure the surgeons know the cancer has not spread. When the patient is young, strong and healthy, more aggressive surgery will be employed. Surgery is performed in 2 different ways. The second way is a palliative procedure which is used for the purpose of reducing the symptoms of the cancer and not curing. Effective treatment surgery cannot be performed. Surgery is the most common conventional option for treating peritoneal mesothelioma cancer. The future is pretty grim for those with peritoneal mesothelioma. However, new peritoneal mesothelioma treatments are being developed and experimented with every day, so there is always hope for a breakthrough. http://www.mesotheliomaattorneyfreeconsultation.com. Francisco Rodriguez. About the author: do you need a mesothelioma lawyer?